Can you please tell me what some of the biggest adherence issues are for people with atrial fibrillation?
Yes, it's a good question actually, and generally speaking, the adherence issues across chronic diseases, including atrial fibrillation, are different for different people. So what we find is that sometimes patients will have concerns about the condition itself as well as the medicine, but also sometimes patients just have issues and concerns around remembering to take their medicine, but also access to medicines, so maybe not being able to get to the pharmacist to collect their prescription. But in relation to patient beliefs, we know that with atrial fibrillation, it's largely for most patients an asymptomatic condition. So what that means is patients don't experience symptoms as a result of having atrial fibrillation, so therefore they don't necessarily see the need of the medicine. Because if you're not feeling sick, why then should you take medicine? So that's an important concern. We also know that many patients don't necessarily see atrial fibrillation as having significant future consequences should it not be looked after or treated, and so that can prevent patients from engaging with treatment as well. But more than that too, we know patients have real concerns about taking medicine over the long term. This may be around issues related to, I guess, withdrawal or tolerance, but also side effects of medicine and pharmaceuticals generally. So these can all be big issues for patients, and it's really important to understand what the issues are for that unique patient as opposed to applying kind of blanket rules for every patient with atrial fibrillation.
Great, thank you.
Thanks.